Welcome to episode 46, Human Health in Space. On today's Space for Women show, we have two eminent persons in the field of space science with us today. That's going to be Dr. Anthony Yuen. He's an assistant professor of clinical emergency medicine at Weill, Cornell Medical College, and Dr. Rochelle Velho, who is an acute medic intensivist, rocket doctor, and also the crew medical officer for the Austrian Space Forum. Our episode today mainly focuses on space health, its importance, and how much of a role it plays in space missions. We will also delving into who a space doctor is, the responsibilities of a space doctor, research risks, and various factors pertaining to the profession. Today's episode also explores analog space risks and the WHO model for health and how to stratify the risk. We hope you take back some great insights from this panel discussion on human health in space and how to be a healthy human in space. Now, let me once again welcome Dr. Rochelle Velho. She'll be our first presenter today, and Dr. Anthony Yuen dialing in from, Dr. Rochelle Velho from the United Kingdom, and Dr. Anthony Yuen from New York today. And my co-moderator today would be our PhD student, Jonna Ocampo. She's dialing in from the United States. She's a biomedical scientist and the founder of CDC's Mission Microgravity. As mentioned, a PhD student in microbiology and cell science at the University of Florida. She has a payload manifested for Firefly Aerospace Alpha rocket inaugural mission in 2021. Her biomedical experiment is manifested for Citizens in Space, United States Rocket Academy, Future Suborbital Flight, and she's also awarded as 2018 scientific mission LEMO 2 Greenberg satellite. Jonna was also awarded to the NASA Florida Space Grant Consortium Fellowship in 2018. Once again, thank you for participating today, and I hope you enjoy the time with us. I'll now hand over to Dr. Rocky.
Thanks very much for that introduction. So thank you for inviting us to talk about human health in space. I'm going to be talking with my co-lead at SGAC SMLS, Dr. Anthony Yuen. A bit about us. So I'm an acute medic and intensive care doctor in the NHS in the UK, and I also have a background in public health medicine, working with the Ebola crisis and Public Health England, as well as with policy with UK Space Labs and SGAC SMLS. I'll hand over to Anthony, if he wants to just unmute and just introduce himself, and then I'll carry on with our presentation.
Thanks, Rochelle. So I'm an emergency medicine doctor working at Weill Cornell in the New York City. And then also a space medicine researcher there. I also do a lot of research in medical simulation, and I work a little bit with in the biomedical team with the Austrian Space Forum. As well as medicine, I have a background in engineering as well. And with part of SGAC, I'm also the co-lead for the Space Medicine Life Sciences Project Group, as well as the co-chair. Thanks, Rochelle.
Thanks, Anthony. So when I started putting together this presentation with Anthony, we came up with a bunch of questions that we get asked quite commonly, because the term space health conjures up all sorts of questions. I commonly get asked at work, what is space health? What is the role of a space doctor? What risks are there? And what actually happens to the human body in space? And the majority of people that I work with, especially students, ask me, how do I actually become one? So hopefully we'll cover all those areas today in our talk or in our panel discussion afterwards. With regards to what is space health health in general encompasses three elements. So the physical, how you're feeling day to day, how your body is working, your psychological health or your mental health, as well as your social health. And I think there's less of an onus on psychological and social health when it comes to thinking about health immediately and that definition. And these are the three elements that are proposed by the WHO model of health. Space health is a fairly new area of medicine, and it encompasses everything from prevention through to cure. So we're not only trying to cure any diseases that occur during a spaceflight mission for an astronaut, but we're also thinking about measures, and that's 80% of our job, is to look at prevention and how can we prevent those diseases from occurring. And from this slide, I know it's a little bit busy, but all I want you to really take away is that the extreme environment of space is very harsh. The atmosphere isn't built for humans, nor are the acceleration and deceleration forces that we put our astronauts through during ascent and descent. So that leads to an abnormal body physiology. So they can be adaptive processes, but also maladaptive processes. And when they're maladaptive, that's called disease. So we need to be able, as doctors, to monitor and diagnose those diseases, but even working back, preempt these disease processes in order to prevent them. And that's called designing countermeasures. So as I said briefly in the last slide, when do we play a role as rocket doctors? We think about the pre-flight, in-flight, and post-flight areas of an astronaut's pathway into space. Pre-flight, we have to make sure that the astronauts that we select are fit for the job. They're able to physiologically withstand the pressure of being within that spaceflight environment, both physically and psychologically. In flight, we're thinking about, are they trained with the countermeasures that we propose in order to prevent any disease processes occurring? And post-flight, our main job is to work with the rest of the wider multidisciplinary team to think about rehabilitation and getting them back to baseline. This is a really nice summary from the Global Space Exploration Roadmap, and it shows our vision as an agency as well as commercial to go to Mars. So it's not just to go to Moon, but beyond to Mars. And by 2040, the goal of humans is to be on the Martian surface. And as doctors, we need to try and see how we can best facilitate this and make this happen for astronauts and to facilitate human exploration in general. And all these environments are stepping stones to understanding the human body. So on Earth, in extreme environments, either on Everest or deep dive for NEMO missions, you have different Gs, you have different ascent profile, different atmospheres. We can learn a lot just on Earth itself and in the extreme environment of Earth itself. And then going beyond to Moon, you have hypo-G and 1/6 G. And then on Mars itself, you have 1/3 G. So those are all different environmental considerations. So I work quite closely with the Austrian Space Forum as their chief medical officer, with Anthony as well. And analog space risks and space risks have a lot of overlap. But the 5 key elements of thinking about radiation, which some space analogs do have, so some terrestrial environments do have that, isolation and psychological stress, being in a closed team, either by yourself or with a few people in the middle of nowhere, and that's the same as being in space. The distance that you have from Earth. Now, you can introduce time delays, and the Austrian Space Forum does for its missions, which are 4 to 5 weeks, either in caves or in remote desert environments or on glaciers. Gravity, so we can't actually introduce hypo-G on Earth, but we can design suits like spacesuit simulators like the Aruda X to try and emulate what it would feel like to walk on the surface of another planet like Mars. And environmentally, being within a spacesuit introduces a different atmosphere that you need to control in order for a human to breathe. And we need to think about how these risks then translate to impact on the biological, psychological, and sociological elements of health. So how do we actually stratify the risk? Like, is there a model? And the Shell model is actually a human factors model developed way back in the 70s. And Pete Hodgkinson, Kevin Fong, and Bonnie Postle wrote a great paper on space medicine in general, and actually said that this is the best model to think about health. So the astronaut is software. You've got your human body, you've got your muscles and bones, etc. The hardware, so any suits or anything that you're actually integrated with in order to perform tasks. Your environment, which is either the suit environment or the in-habitat environment or the ISS environment. Thinking about liveware in terms of individuals, but also how they interact with other individuals. And we stratify risk within these categories. And there's always more than meets the eye. There's layers of risk. And the terrestrial risk that we can think about, for example, different social distancing measures during COVID-19, as well as analog risks, all the way through to NASA HRP, so the human spaceflight roadmaps that you can see, all of them are color-coded and nice and pretty, but actually, when you dig through them, reflect the fact that there are real risks to going to space. And you have to think about what's risky on Earth. So COVID-19 is present not just in your immediate environment, but also in an analog space environment, as well as the space environment. And that's a great example of something that permeates all the way through. This is just a photo of us with the Analog Space Forum. So this is Bonnie Posselt and myself with 2 of our analog astronauts. So I guess the next thing to ask is, what actually happens to the human body in space? I mean, do we even need space doctors? And the answer is yes. And the reason that we need to do that is because there are so many different impacts on this human body. And what I'm going to do in the next couple of slides is think about the why and the how of what happens to the human body in space. This is a great infographic from the Canadian Space Agency looking at just summarizing what happens to the human body in space. And I'm going to do a deep dive into each of these topics. So the spaceflight environment itself is the why. The why does anything at all happen to the human body? And just accelerating, as you can see from the Virgin Galactic launch profile, you're accelerating and you've got high Gs going up. And then when you're at apogee, or when you're actually in low Earth orbit, you have atmospheric changes where you are in free fall. The actual in-hab environment has different CO2 levels, etc. And those are all in addition to the risks that I've already talked to you about. The how is, what body systems does it actually affect? And there are 135 different subspecialties in medicine and surgery. So if you can divide it all up by body system or by interaction between body system, then you come up with so many different, you can come up with loads and loads of textbooks about this. But to really simplify it and break it down, I'm just going to go over the when. So the neurovestibular system, so your brain and your ears, and how we know whether up is up or down is down, all your fluids and electrolytes, which are really important, and your cardiovascular system tend to adapt pretty early on in your flight profile, okay? Whereas later on, your bones and your muscle continue to try to adapt to what's happening to you within the ISS. But the point that we found is 1.5 months, when you have this point of adaptation where everything seems to have tried to adapt as best as possible. Now, the solution is something that we're continually umming and ahhing about, and the solution is preventative countermeasures. So prevention is better than actual intervention and treatment, and these can be physical or pharmacological. Now, I'm just going to go through the different processes that happen. So with regards to the launch profile, you have physiological changes that occur secondary to those high Gs. And one of the things that can happen is G-lock, which you see in fighter pilots. So you can actually have loss of consciousness while you're in ascent. And that is something that we cannot have in our astronauts. So you have countermeasures like G-trousers or centrifugal training for astronauts and fighter pilots. And one person I'd like to highlight who's really delving into this is Bonnie Posselt, who's looking into it with the RAF, or the Royal Air Force, as well as the US Air Force. And this is one of her many different subject areas. So I'd like to highlight her work. So psychological changes, so I've talked to you a little bit about the fact that all body systems are affected, and psychology comes within that. When you're in that environment of free fall, you have an overview effect and an adjustment effect to the fact that you're completely removed from your home, which is Earth. You also have an us versus them phenomenon, which is where you think that you as the crew are completely removed from the mission control center. And we see that in analogs as well as in space, so on the ISS. And the countermeasures we can have are to have strict flight plans that are predetermined in collaboration with crew and ground. Also have regular calls with family and one-to-one with psychologists. Pharmacology is less effective in this domain at the moment from the current cohort that we've seen. And sleep and hygiene is really important because that's completely disrupted in the space environment. So going on to the neurological system. So when you're on free fall, you have lots of neurophysiological changes. One of the ones that you might have heard about is swelling of the optic disc, or due to raised intracranial pressures, called space-associated neuroocular syndrome. And I think that Stephen Smith is one of my favorite astronauts. He basically said the body isn't built to deal with zero-G, and we have to try and work out how we can come up with ideas to mitigate against the impact of micro-G. And one of the things that may be on the horizon is something called GLP-1 drugs. So certain drugs that we use for raised intracranial pressure patients on Earth, called IIH, we can use for astronauts as well. So that's one of the emerging things. Physiological changes due to radiation. So this is just a quick round robin on all of these things that happen to the human body. So as you can see, there's a lot of areas that are vulnerable to radiation. In women especially, our breasts are very vulnerable to radiation and high doses of radiation. And it has been proven that in radiographers who have exposure to radiations as they run CT scans day on, day out, might be at higher risk of breast cancer. So astronauts, by that regard and extrapolation, may be at higher risk of breast cancer, but not enough women have been into space and haven't been followed up for long enough to know whether or not that is true. In terms of this area, Virginia Watring gave a great TED talk, and I would encourage all of you to listen to it, looking at the pharmacological interventions that you can use for spaceflight, and Becky Blue as well. And they both do a lot of work on radiation as well as space pharmacy. And the heart, what actually happens? So the fluid shifts that happen when you're suspended in free fall mean that you look like an upside down triangle of fluid. So all the fluid shift goes up. This puts a lot of pressure on your heart to pump in a different way. And because it pumps in a different way, it deconditions. So you get cardiovascular muscle deconditioning. So your heart actually doesn't work as well as it should when it comes back to Earth. And one of the countermeasures that has been proposed by the Russians is a penguin suit. And that's been developed over time. So ESA now has different suits that it is trying and testing. So that's one of the things that we see. Now, you're probably wondering why I put this slide in of chocolate, but essentially it really illustrates what happens to an astronaut's bones. So as you can see, an aero chocolate bar is very aerated. So when you get deconditioning of bone and mineral density on the ISS, that's what an astronaut's bones would look like, very porous. Whereas our healthy bone should have very dense cortical meshwork, still have little holes in it, but actually be very dense, like a crunchy on the inside, and have that thicker chocolate layer on the outside, which is your bone mineral cortex. And I did a bit of work a couple of years ago looking into this, and the best countermeasure is actually exercise and thinking about loading and unloading that bone. And we still haven't actually landed on the best technique to do this. One of the people who's really prominent in this area is Julia Attias, who's doing bed rest studies with ESA, as well as Kirsty Lindsay, who's doing some work with the Northumbria lab in this area as well. So you're probably wondering what relevance this all has to women. And the best researcher that I can point you towards or signpost you towards is Varsha Jain. who's done a lot of work with NASA astronauts, female NASA astronauts, looking at their menstrual cycle. She's a space gynecologist, and she actually has delved into the fact as to which hormonal therapy or hormonal intervention is best to control periods while you're in space, because having periods in space can be quite messy, but also it blocks up all the toilets and means that you can't actually process that water and recycle that water. So it is a resource problem. So it's something that has multiple impacts on the astronaut, the female astronaut, as well as the rest of the crew. And this is a slightly older figure, but it shows what it says on the tin. There's been hardly any women that have gone into space. So our knowledge of what happens to women, the female physiology in space, is limited. So we need more women to go into space in order to understand the gender differences and variations more so. And at this point, I'm just going to hand over to Anthony to do the rest of the presentation.
Thanks, Rochelle. So we talked a little bit about humans in space and all the other risks associated with it. And you can see, there's a tremendous amount out there that can affect the human body. And there's still a lot of research to do. But that's actually only one flip side of the coin. Only one side of the coin is in space health. The other side is actually looking at how space can be used for human health on Earth. So quick, please. So for the next section, I'm just going to focus a little bit about how space technology and space medicine have an impact on Earth. So the first section I want to talk a little bit about is technology transfer. So a lot, as you probably are well aware, in space, there's a lot of technology and innovative ideas developed that actually can have tremendous impact on Earth. And one of the examples that we have here on the slide is actually related to the heart. So on the left, you can see that is the main engine on the space shuttle orbiter. And one of the issues that, and the person in the middle is actually a very prominent cardiac surgeon in Houston, Texas, Dr. DeBakley. And the issue that he was having is he's trying to make basically what is essentially an artificial heart to help people who have heart failure. But the pump that he was designing was actually damaging the red blood cells too severely for it to be of any use. And so him and the engineers at Houston actually worked together to build a new impeller that was actually based on the impeller in the engine fuel feed of the shuttle orbiter to build a much better heart pump. And you can see this is an example of where incredible technology from the space era is actually being implemented straight into medicine to make an impact on Earth. And it's actually quite a cycle in space medicine and space health, is that as we tackle some of the big issues in space health, for example, take the example of issues with bone and bone loss. If we're able to figure out how to prevent bone loss in space, you can actually have tremendous impact on Earth. Osteoporosis is an extremely common problem in the elderly population on Earth. For people who are older, you just lose bone as you get older. To people who are unfortunately confined to beds when they're sick, and they lose a lot of bone mass. And so if we're able to figure a way to actually reduce that bone loss, that will actually improve the outcomes of a lot of patients on Earth. To prevent them losing bone and potentially getting accidental fractures while they're sick or as they get older. So you can see that there's a cycle there. The second part is that there is a lot of technology being developed in space that can make a huge impact on Earth. And you've been starting to see, a lot of talk about how space and commercializing space is actually a key area of industry that's being developed. And there's a lot of potential in that because there's a lot of unique aspects in space that you cannot find on Earth. And one of the key things is the presence or the the lack of presence of gravity or microgravity itself. So there's actually a lot of companies. The majority of commercial players and experiments on the ISS are actually biological or life sciences related. And a lot of those experiments, some very basic, some a little bit more translational, are all looking at how technology in space and with the microgravity can actually impact on biological processes and how we make drugs and so forth. So on the left side, with TechShot, they are actually looking into how to do 3D printing of organs in space. And that is actually a huge challenge on Earth because 3D printing organs on Earth is not very successful. And people think it's actually because the structure of the biological substance are very delicate. So it just collapses in the gravity. So we're hoping that there's no gravity in space, and that's going to make a huge difference in our ability to 3D print organs and tissues. And that's going to change the transplantation world. And on the right, there's a lot of drug companies who are looking into understanding how protein behaves differently, how molecules behave differently, how drugs behave differently in microgravity and in manufacturing. And so that's going to actually technology that makes a tremendous impact on how we care for people on Earth. Next slide, please. A first thing that I think, as doctors who are interested in space is the presence of telemedicine. So in the COVID pandemic, we've been seeing that there are a lot of actually relevance here because during the pandemic, during the surge, a lot of our ability to provide our normal healthcare has been decreased because of us being inundated with patients with COVID. So telemedicine became a different way of actually providing care for patients where there's no risk of being of infection transmission. And also it really makes healthcare more accessible to people. And this is particularly important in the developing world, is that there's just not enough doctor in a lot of places in the world. And for a doctor to travel all around those places is challenging and expensive and time consuming. And that same doctor can probably see a lot more patients through telemedicine if there's a network set up. So really, telemedicine is going to change a great deal of how healthcare is being accessible throughout the world. And it's going to actually change a lot of how doctors are going to practice medicine all across the world. You can also offer specialized consultations so that your specialists, one or two specialists in a country, can really cover the whole country easily. And as well as education of healthcare providers all across the world. Next slide, please. Now, so in the past, communication is very difficult. There's a lot of places in the world where you can't get good communication. Satellite phone is like an example. They kind of go out of signal all the time. And really, with telemedicine, you really want to actually see video because actually seeing through, on video makes a huge difference in how you can care for that patient. So you're not only just listening. And so one area where it's, space is really rapidly changing this is the mega constellation and communication satellite systems like Starlink and OneWeb. And you can see how they intend to really cover everywhere on Earth with these massive numbers of small satellites. And then with just like a small dish set up, you can actually get 4G communication, good enough for a video and audio signal. And that's going to really revolutionize how medicine is being provided on the ground. And that's exactly how we're going to revolutionize how medicine, that is exactly how medicine is being provided on the ISS. So telemedicine is going to play a huge part in how healthcare is being developed. And then finally, I want to talk a little bit about remote sensing. So by now, I'm sure we're all very familiar with that picture on the left-hand side of the screen, and that's Ever Given being stuck, blocking the Suez Canal. And that's been huge news. And I'm sure a lot of you have actually seen, this photo of this ginormous container ship blocking the Suez Canal. So the people who make those pictures are actually a very interesting group of companies, Planet and Maxa being some of them, as you're well aware. And how does that got to do with health and medicine? Well, the thing is that their mission is to actually image Earth on almost a daily basis. And there's a lot of potential in the remote sensing and Earth observation world to actually impact on health, because where there's human, that you can actually see from orbit, and there's changes on Earth that you can actually use to actually understand a little bit better about human health. So next slide, please. So here you can see that this is a Earth observation data set from China just at the start of the COVID-19 pandemic last year. And here we are measuring nitric oxide, which is a known atmospheric pollutant. And so in January, you can see a lot of nitric oxide, especially near the big cities around China. However, because of COVID, they institute a lockdown. And so by February, you can see that there is not much nitric oxide anymore. And why that's important is Earth observation platform remote sensing could really help with what's in our health field called epidemiology and public health, because we're understanding health in a population level. So a lot of this data coming from all across the world can really kind of feed into that public health model. And here, for example, we can use pollution data to understand how well a lockdown is being followed by the population. And this could be really across the world. Are people actually moving around, or are people following the lockdown as per what the government is instructed? So this is a way of actually tracking real time and giving data into that public health model. Next slide, please. And why is this all important? So all of those technology that we talked about, from tackling those issues, with the change in physiology in space, and trying to overcome all of those risks and challenges of long-term space flight, all of those things are tackled through, transitioning those technology back to Earth, and then through the Sustainable Development Goals, is going to have an impact on health, as well as a whole ton of other sustainable development factors and goals all across the world. And you can really see that, it is not just impacting on, goal number 3, where it's about good health and well-being, but good health is the basis of a lot of the other SDGs as well. And because without, and then also, using space technology to tackle some of these sustainable development goals is also going to actually feed back to the health of the population. And that's why, it's really important to understand that space has a big role to play. If you can click next, please. And that's what, the Space for SDG initiative is really well worth exploring that, especially even if you're interested in just health or medicine alone. There's a ton of work that we can do through space that will impact on health and well-being of everybody on Earth through space technology. Next slide, please. So the last area that I want to address a little bit is, how to be involved in space health. And that's a question that we always get, and we commonly get. And I just want to kind of talk a little bit about, some of the thoughts about that. Next slide, please. So the biggest thing that I want you to get out of this is that space health is a huge field. And it is also a field that is very much multidisciplinary. Rochelle and I are both physicians, but the reality is that, doctors only play, a part of this. We need a multidisciplinary approach to this problem. And so we need, people who are from other aspects and other training. So like nurses, biologists, pharmacists, people who look in drugs. We definitely need engineers. We need psychologists. We need a lot of researchers, scientists, and we even need lawyers. There's a lot of stuff with ethics in space. And all of those people can really contribute towards all of those risks and challenges that we talked about today, that Rochelle and I talked about today. And so really, even if you're in this talk and you're not a doctor, you don't have to be a doctor to be playing a part in contributing to our space health and tackling those challenges in space health. And I really think that's the first important thing to get out of that, is that we need everybody. And teams are always multidisciplinary in space medicine research. The second part is that, if you go back to the slides before, Rochelle, the second part is that I want to talk about is that there's really not a single path in space medicine or space health or space doctor. And in fact, the more people you talk to in our field, the more amazing it is with the multitude of different pathways that they have taken to get to where they are. I think the most important thing is that, the first thing you need to focus on is to be good at your basic specialty. So if you want to be a space doctor, you really need to start being a good doctor first, because a lot of the work that you're gonna kind of put into space medicine, space health, comes from the experiences that you have in a day-to-day job as a doctor. You can't skip that, because that's the only way that you can understand about how you apply, medicine to space. And the reality is, it's not just being a doctor and then being a space doctor. It's actually being a doctor and being all kinds of different doctors, be it family doctors, cardiologists, brain doctors, bone doctors, any specialty. It's about being good at that specialty and then using the latest understanding and the latest research from that field and then applying it to space medicine. And that's really how the model works. And that's for the majority of people, they will always have a background in their own field. And like the multitude of amazing women doctors and researchers that Rochelle have kind of highlighted, if you look in their biography, they have a fantastic background in their field of specialty, and then they're applying that to space. So I think that's like the second most important thing that I want you to take out this talk, is on the pathway to that, you need to kind of consider, to be good at what you do on Earth, because we need all sorts of different specialists to contribute into this area of space health. Next slide, please. And then third and finally is about networks. So networks like what Hein is doing with this fantastic series, with Space for Women, and also other, organization out there. And I'll just go and talk a little bit about the ones that I'm representing, which is the Space Generation Advisory Council. And again, there's a network globally that's really connecting everybody who is interested in space who's passionate and interested in space together. So that's really kind of like being part of that network is what really kind of helps you understand where you can contribute within the space industry. And I think that kind of networking and knowing is really, really helpful. Next slide, please. One area that we kind of, where space medicine is actually really kind of in a policy world within the Yuen COPIUS, is on the Committee of Peaceful Use of Outer Space. And from a space medicine perspective, if you click next, we actually kind of bring from our perspective in space medicine to a working group called Space and Global Health Working Group. So this is kind of one area where a lot of the activities I talked about in the last 4 sections, we're talking this from a global kind of perspective, and where each country can kind of like use the space technology to impact on health in their own countries. Next slide, please. Next slide. And then finally, talk a little bit about the project group that Rochelle and I belong to, which is the Space Medicine Life Sciences Project Group. And here, as you can see, there's a lot of interest everywhere across the world about space medicine. But one thing that we've noticed is that, a lot of us tend to be quite isolated or siloed. And so the purposes of this project group is to really be a global interdisciplinary platform that connects everybody interested in space medicine together. And so that we can actually work together and collaborate and work on projects together. And I think that's really kind of, the next step. So really, our focus is about tackling, how do you make space application address terrestrial healthcare? And the next one is, kind of to address how we tackle these, big risks and challenges in space medicine, and how do we work towards more standardized evidence-based care for space. And so this is what really our group is about. So that's the end of our presentation. I'll hand it back to Heinz for the next part of the talk.
Thank you so much, Anthony, for this great overview on human health in space and how to access space medicine careers. On your graph, you forgot the physiotherapist.
Oh dear,
yeah.
I will add that to my slide.
I've been working in the health industry for over 20 years, and what I see, what I probably would add on is not to shy away for if you are specializing very late into any careers, right? So there's a great book maybe I want to share with you, how generalists triumph in a specialized world. So this is a question from a mentee. They often ask, am I too old? Am I too old to access, start with space medicine? Now there may be an attorney want to transition into space medicine or vice versa. So that's a great resource. So never shy away to enter any industry too late with the help of current technologies. I think anything is possible, right?
I totally agree with that. And I actually honestly entered this probably late myself, probably in my very late 20s. I always had a passion for space, but it wasn't until, late in my career, after med school, as I was actually in training, when I realized, that space medicine could be a research field that I can be part of. But I think here, I think really important to emphasize is that it's never too late, and you're bringing across a wealth of experience that you will need in this field. So it's never too late, and we value those experiences greatly.
Yeah, in education, it proves slow struggle proves better than fast learning. So right, so yeah. So I'm very sure that my co-moderator Jonna has some say there too. We now head towards the panel discussion.
Thank you, Yuen. Okay, well, we have a few questions that came in advance, and we'll start with, what are the showstoppers at present for long-duration human spaceflight, for instance, in going to Mars?
So the reality is that there is a lot, but let Rochelle and I focus on pretty much the top two. And I'm going to talk about, from one of those is the issue of radiation. So basically, right now, in terms of human spaceflight, we are very much kind of right on the first baby step of human spaceflight, because our human presence in space is in low Earth orbit, and that's within the Van Allen belt. And the Van Allen belt is a quirk of our magnetic field that help us protect us from some of the most significant space background radiation that can be damaging to human life. So the ISS is within, underneath this Van Allen belt, so that's protected. But as we actually consider going to Moon and definitely going to Mars, we're definitely outside of that protection field. And then, our astronauts, during their transit to Mars, which could be anywhere up to 200 days each way, is now exposed to a tremendous amount of space radiation. Now, some space radiation, like X-ray and like the gamma ray, they can be shielded, and that's fine. But there's still a significant amount of radiation, mainly called galactic space radiation or background space radiation, that is actually impossible to shield. And these are, elements of, radiation particle that's traveling at nearly the speed of light. Once it impacts on something, there's a whole host of secondary reaction. Nothing can protect them, and these can have significant damage to human health. And it's not just, radiation sickness, where you kind of think about when you have a lot of exposure to radiation, you throw up, and so forth. But it's actually the longer term thing. Basically, it degrades your ability of your body to function. Your brain, your neural system, your nerves get degraded, so you're not as good with your coordination. It also degrades your heart muscle, so your physiology, your heart doesn't work as well. And of course, it can change your genetics, and then with any implications for cancer laterwards. So all of those are tremendously worrisome, and the reality is that we don't really have a good answer for those, but a lot of the space agency are really looking deeply into that. Rochelle, you have another one?
Yeah, and I think the other risk factor is freefall or microgravity. So gravity is something that we're so used to. We evolve and we age as children in the 1G gravity of Earth. When we're put into the microgravity environment, so when you're in free fall on the ISS, or when you're in hypogea on Moon or Mars, you actually don't have those signals to on a molecular level, to your bone and your muscle, telling them what to do, telling them to build more or take away. And we're in this constant flux of building and rebuilding and changing the architecture of our bone and muscle. And what we found is from a series of different bed rest studies, as well as studies in astronauts, is that there is a big anatomical variation in this. And your hips and your spine, so your vertebral column, that stack of bones that helps keep you upright, are the ones that are most affected when you take away gravity, or you still have gravity of Earth, but you're in free fall. And exercise to an extent, like resistive exercise devices like the ARED on ISS do help, but they're not the full solution. So they can improve, say, your bone mineral density by 0.9 to 1%, sometimes a little bit more depending on which area of the body you're talking about. But actually, you still have porous bones when they look at your vertebral column and when you look at your hips, when you look at astronauts coming back. So we haven't solved it. This is something that we're still thinking about, and we need to work with engineers to try and come up with solutions before we go to Mars.
And Rocky, with these changes that are happening in space, do we know about the differences between the male and female physiology in space and these differences that are occurring?
So we don't have a full understanding because, as you know, there haven't been enough female astronauts that have been exposed to the space environment. So in terms of statistics, we simply don't have a powered sample to make any conclusions, like definitive conclusions. We do know that men and women have different hormones that actually control or orchestrate what happens in the human body. That's from bones all the way to cognitive ability. And we don't fully understand that in terrestrial medicine, let alone space. We do know that female astronauts experience more space motion sickness on entry, whereas male astronauts actually experience more space motion sickness when they descend. So we don't know why this is happening, but we do know that's a fact. The other thing that we find in female astronauts is more orthostatic hypotension. What that means is they're more liable to faint when they stand up, when they come back to Earth. And we don't fully understand why that is. So there's lots and lots of different gender variations in physiology and hormonal orchestration, but also obviously women go through periods. We have a menstrual cycle, and that's very real for female astronauts. And I highlighted Varsha Jain, who's a space gynecologist who's worked with Virginia Watring and the NASA female astronaut cohort so far, including retrospectively, to try and figure out what are the best contraceptive pills to try and pause your menstrual cycle during a spaceflight mission. When Sally Ride went into space, engineers actually packed 200 tampons for her mission because they just didn't know anything about it, and it was a taboo subject, and it still is. So I think that that's something that we still need to look into.
Okay, my next question is, besides what was already mentioned about the implications of radiation and cancer, are there any other long-term health concerns for returned astronauts once they come back to Earth?
Yeah, so I'll start and then I'll hand over to Anthony as well. But like Anthony said, it takes 200 days to go to Mars and then 200 to come back. And you're not just going to go there and come back. You want to stay and do stuff. You want to do experiments. You want to see what Mars looks like and hopefully take first female step on Mars. But we have few data sets that actually tell us what happens in the long term to the human body. The twin studies were really, really key to this and revealed quite a lot of what might happen, but it's all postulation. One of the things that Chris Mason and his team were looking at at Weill Cornell, where Anthony works, is basically looking at radiation and how that impacts on genetics and how that changes genetics. And you can compare twins much easier because they have similar or the same genetic profile, depending on whether they're identical or non-identical. So that's one of the things. And the other thing is something called space-associated neurological syndrome, which is where when we go into microgravity or into freefall, you have a shift of bodily fluid towards your brain. So you have a raised intracranial pressure, which then has an impact on pushing your optic disc and flattening it, which they found on MRI scans when astronauts come back down. But we don't actually know. But something that you really find is, and you found for many, many years, is that eyesight changes in astronauts. So you go from 20/20 vision to hardly seeing much, especially long distance. And that's because the shape of your eye actually changes. And that's why you have a box of glasses on the ISS. And astronauts try different glasses to see, which ones work and which don't. So eyesight is definitely one thing, and you need to see to know what you're doing to pilot that expensive piece of spacecraft. So eyesight is really important, and that changes. Neurologically, that changes. And I don't know whether Anthony wants to talk a bit more about the psychological impact as well of space.
Yeah. In a long duration mission, you'll be kind of in quite a confined space with a very small group of people, and especially during travel to Mars, for example, as you travel further away, there's a greater time lag in communication, right? So right now, we would notice that even if it's like a few seconds lag, going to Mars can be anywhere up to 20 minutes. So really, like real-time communication does not become possible, and that's very isolating. So you're really not able to have a real-time conversation with people you know or love back home. And really, the people who you're in a tiny tin can with is the people who you work with. So there's obviously a huge amount of concern about how that works on the psychology of the person and also of the team. And there's actually a great deal of fantastic analog-based mission on the ground trying to understand that. One of those was Mars 500, as well as other analogs. And some analogs, look at why team breakdown and kind of conflicts occur, or what's the best model, what kind of best model would gel teams together. But there, I think Mars 500 also looked into how one of the results coming out was that the group eventually kind of evolved, and there was, the group will think kind of together. There was like a group think going on, which could be good or bad, but definitely the conflict were low. So there's definitely, changes and risks from that kind of perspective. And then after a long space mission, there's possibility that there's some sort of like adjustment period, where kind of, your mental health is trying to adjust back into reality. And that could take anything from a few days to a few months. And it's not very well defined, but it's definitely been reported. So all of those are kind of concerning. And then finally, I think one other thing to kind of think about is, as with prolonged microgravity, the physiology of actually how to walk and move around when you change from a long period of no gravity to some gravity is very difficult. So when you see the Soyuz return back to Earth, you often see, the medical crew coming in and then helping the astronaut, and they get put on seats and they get held out, and they don't need to walk. And there's a reason for that, because think about, sometimes when you sit on the sofa for too long, you stand up, you feel lightheaded, you're almost fainting. That's what we call orthostatic hypotension. Well, coming back to space is like sitting for like tens or hundreds of days and then getting up. And so they're really easily prone to fainting, and it's very hard for them to get up properly. So on Earth, there's a whole support crew to help them to get up, but there's none on Mars. So understanding what happens when they get to Mars and how are they going to make sure that they're able to actually even take the first step and not just fall, is going to take some thinking. And so those are kind of like long duration spaceflight implications that we still have to figure out.
So as in referring to your slide presentation, I have a question myself. With the intracranial pressure neurological impacts in space, what are the emerging social implications and interactions for a crew?
So what are the emerging social implications as a result of increased ICP? Or
Yes, and their effect on the individual and their interactions with the crew.
So I think at the moment, the raised ICP that causes SANS causes visual blurring due to the papilloedema or the optic disc swelling. So obviously, depend on longer duration spaceflight, say to Mars, we expect that this will evolve and get worse unless we come up with countermeasures or solutions or pharmacological interventions. If this continues and you get a blind crew member who's meant to pilot or integrate themselves and actually participate in experiments, then socially the rest of the crew has a lot more pressure, because they have to offset and do the tasks that crew member might not be able to perform safely. So I think that the team dynamic and the group interaction would change. Obviously, this is a hypothetical scenario, so we wouldn't be fully aware of it. But there have been case reports from Antarctica, from the ESA Concordia station, where you have had disabled team members due to a broken leg, for example, who can't participate and do their share of the work, which puts the rest of the team under stress, and therefore they become isolated from the rest of the crew. And it's almost, it becomes very unpleasant for that crew member. Obviously, it can go the other way, and that's which is where you become more supportive and you become over supportive of that disabled person, to the point where that person becomes annoyed about what's happening. So we don't have all the data yet, but the case reports do suggest that it does fracture team dynamics and interactions.
Yeah, thank you for that, those answers and your specific examples for those operations and the changes. That's very pertinent, and I think the viewers will really enjoy your examples. So when astronauts do fall ill in space, what kind of illnesses do they suffer from?
Good for Anthony.
I can start off first on that one. So the lucky thing right now, is that the ISS is very close to Earth. And so for a majority of illnesses, most all of them have been fairly minor. I think, some of the most notable one have been infection related, and in fact, urinary tract infection. And there was a case where one of the astronauts had getting a urinary tract infection, and that actually went beyond, the bladder and kidney and became what we call sepsis, which is like, almost sepsis, which is like where the infection is going to the rest of the body. And that could be dangerous, especially even on Earth. And we're not even sure how that behaves in space. But luckily that was treated, appropriately, and that was not an issue. So a lot of them have been, pretty minor infections or skin conditions, because as you understand in space, it's very hard to actually do personal hygiene well. They're not really taking a shower in space, and so they can get a lot of rashes in space that are very hard to control and very uncomfortable. And that can, you think about it, that really can impact on work. A bit of eczema really kind of ruins the day. And then some of the more dramatic ones have been like pain from kidney stones, which kidney stones like one of those ones that, like, because your bone is losing calcium all the time, you're more at risk at forming kidney stones from the calcium. And anyone who have a kidney stone can tell you it's one of the most horrific experience, worse than childbirth. And so that really can take out a crew member. You're not going to do anything while you have a kidney your stone going through your kidney. It just hurts very bad. So those are kind of fairly minor, and we're pretty lucky that there hasn't been any significant one. I think Rochelle can tell you a little bit about a near miss on the ISS.
Yeah, so one of the things that has happened is one of the astronauts did have a period of an arrhythmia. So your heart doesn't beat as regularly as it should. And that was non-sustained. By that we mean it just happened for a brief period. And therefore that patient's heart rate then went back to normal. So that astronaut was then okay. But I mean, in somebody who is a commercial passenger, or commercial traveler to space, you're not going to be as selected as an astronaut who is selected by NASA or ESA, etc., or JAXA. So essentially, I think that cardiovascular events are probably going to come to the forefront of our medical workload when we have more commercial travelers. And one of the things that a lot of different groups around the world are working on is looking at how do we actually do CPR in space, and looking into robots like the Lucas device, so CPR robots to actually try and help non-medical technicians do CPR effectively for long periods of time in astronauts. So that's one of the things that's emerging. But obviously having a heart attack or having a heart stop is probably the worst thing that could happen to you when you go into space. But that was more of a near miss. So that's not actually happened to an astronaut, thankfully. But I think that's what you meant, Anthony. Yeah, okay.
Yeah, so an audience member would like to know, what is the diet and exercise routine of an astronaut while in space?
So space, so astronauts have nutritionists. So space nutrition is a growing area of study. During the Apollo era, everything was freeze-dried and reported from astronauts. It was very unpalatable of a lot of the stuff that they had. They just had to get electrolytes and basic stuff into them. Now space nutrition is moving more towards being more balanced and trying to provide them with palatable things that they actually feel happy to eat. You have to add additional spices and flavor to space food because your taste buds actually become so foggy, and the nerves that are actually supplying taste, and your olfactory nerve, which basically is for smell, is attenuated in the space environment, and therefore you need more spices and herbs, etc., to try and add flavor, so that they and that's linked to happiness and psychology as well. Like if you eat well, you're happy. So that's one of the things that space nutritionists look into, trying to balance, trying to give it flavor, but also making sure that it's something that the astronauts can link back to their home, like what they like. So I know that astronaut Tim Peake from the UK had tea bags because he had to have tea. And he had to have tea from Yorkshire. So he had that when he went into space. But that's the thing. I think it's very personal to the astronaut in terms of nutrition. There's a whole team that does that.
Yeah, to add to that, that's why I think on the ISS there's such a focus about growing plants and a lot of that is growing to eat the plants, because as you can imagine, like back in the days for like long ship journey, there is no fresh food. There is no fresh food on the ISS until they resupply. And it's really important to have fresh food. It really changes your nutrition, and it has a huge impact to your psychology and your happiness. And so that's why like growing fresh salad and fruit is such a focus on the ISS, because we definitely will need that for long duration spaceflight.
So another audience member asks, once the astronauts are back on Earth, how do they readjust to the Earth's gravity, and what are the processes they need to undergo?
Okay, so they take a few weeks to readjust. And there's a whole team of physiotherapists as well as doctors that actually help them to rehabilitate. And it is an intensive process over 3 to 4 weeks that's followed up even beyond that by the medical team and the wider medical team to try and get that astronaut back to baseline and get them moving again as quickly as possible, and to do it in a way that's safe so that they're not getting any fractures or any muscular injuries. So it's important to do all of that, and they do it in swimming pools using sort of an environment that offloads and gives them control back to try and build up their muscle, and using lots of different exercise devices in order to do that. So that's the main form of rehabilitation. There's also psychological rehabilitation. So for the ESA astronauts especially, they have one-to-one psychiatrists as well as a psychologist who is involved every week, but also more frequently if required, especially if there are other things happening within an astronaut's life, such as grief, etc., which has happened. So I think the astronaut is a human and things happen. So I think it's important to think about all of the different forms of rehabilitation as well.
Well, that looks like all the questions that I have. Yuen, do you see any other questions that are out there on the chat? But thank you, Anthony and Rocky, for your answers to the audience questions. They're very, very thankful for those. Great.
Yeah, I think we covered it all. Yeah, thank you. Thank you, everyone. Yeah, I checked them all. I think we covered them all. Thank you so much for your expertise and your time and your efforts here today on this weekend. Thank you, everyone, for participating. Anthony from New York and Rocky. Hope to meet you all soon at some live events, hopefully. And Jonna, thanks for co-moderating. So if you have any related questions there, I'm sure both of our speakers are available for your question. If not, you go straight to the UNOSA webpage. There are some in space medicine. You can apply there to be connected with a mentor, and I'll invite you to fill out a feedback survey for us so we can improve all future episodes. I'll be also inviting you for the next episode in 14 days. That will be a scientific one. Astroparticle experiments to improve the biological risk assessment of ionizing radiation in the exploratory space missions by our CERN researchers. So as soon as we log off, you'll be able to register for that one. So thank you, everyone, and stay safe.
Thank you.
Thank you for having us.